We are talking about overcoming chronic pain. Chronic pain is pain that's been happening in your body for a long period of time. Before we get started, you should know that we cannot just take on patients or subjects that have chronic pain without a doctor's release, because there could be something very severe going on in your body. So chronic pain is for generally people with arthritic conditions or stuff like that. It can be any disease, but the doctor has to know that they're at the end of their result as far as trying to figure out how to treat this pain. A lot of times we go to hypnosis to treat this kind of pain because we don't want to take an excessive amount of anti-inflammatories into our system. Usually the intestinal tract has some kind of damage on it, so you would want to move forward on something like that. Plus, if you use an extensive amount of painkillers over a long period of time, you will lose your short-term memory. So, don't do it. Find some alternatives. Hypnosis is a great one, and a lot of the high-ranking medical physicians in this country recommend it highly. Okay, couple things. Number 2, there is no limit. There is no limit as to what the subconscious mind can do, but it requires a little bit of belief, faith in the power of your own subconscious mind with your own training in self-hypnosis and the right operator to help you get through it. So, don't wait till you get a huge migraine, okay? I mean, when I get hit with a migraine, I'm trembling. I can't move. It's like, I take 2 hot rags and throw them in the microwave, heat them up, one on my forehead, one down in my occipital area, and then it's turn on that disc just as fast as I can and see if I can disconnect it. Remember this one thing, okay? It's not pain if it doesn't reach the brain, and that's what you're doing. So if you wait till you're severely ill or in pain, you'll not be able to concentrate, okay? And if you load yourself up with a bunch of painkillers, you're not going to be able to focus, all right? So you want to do a little bit of this before you come down with it and just start experiencing the unbelievable power of the subconscious mind through meditation, all right? Self-hypnosis, straightforward. It's really easy. You can buy CDs all day long. You can visit a hypnotherapist like myself and help you get started. Okay, how did I become familiar with it? Well, once upon a time when I was in high school going to JC, I went to a bunch of stage hypnotist shows with Harry Anthony, and I saw him perhaps one night during school. He took my sister, who was a pretty small person, and put her in between stools, and then he stood on her stomach. And what she told me, she goes, I realized what was going on with me all the time, but I just didn't care. And so that's kind of important. Let's see, what are some other things? Once upon a time at a hypnosis show, I saw Harry take his daughter and put her up between 2 bar stools. He took a large brick, and with an 8-pound sledgehammer, he broke that brick, sending pieces of the brick all over the stage. That was, those are a couple of things that I kind of grew up on and always remembered that. That's what made me a firm believer in using hypnosis to get through college, to take better tests, and to be able to focus and concentrate. Boom. Alright. So, there is a Dr. Goldberg who's pretty famous here in North Hollywood. Called him up the other day, talked to him, and he's a dentist. And I would venture to say that the hypnosis and hypnotherapy, hypnosis for painkillers, was probably began in the dentistry department, because ultimately you end up with people that are allergic to anesthesia, so you have to find another alternative, and hypnosis is real powerful. Okay, so Goldberg's around. He's written several books. All of them are really, really good. He usually includes some kind of CD in the back so you can work on your self-hypnosis. All right. Another point that Harry always reminded me of is when women were delivering babies, which is a highly, extremely painful experience without anesthesia, that hypnosis could be used for that. But again, it took pre-training before that delivery process came. Alright. The pain will decrease. If you're using it for chronic pain, the pain will decrease a certain percent. Will it all be gone? Who's to say? Will it help? Absolutely. It will get better. It will become more effective over time because hypnosis is accumulative. Imagine that. Alright, how does it work? Well, let's say, for example, that I have chronic pain in my hip area. I either fell off my horse or just years and years of abuse or use, and it's just worn out. Doesn't have to have a reason, just worn out. You know, what used to have synovial fluid in the joint area, like this, now all that joint fluid is gone, so you got bone on bone, and that's where people really feel excruciating pain with no pain relief in sight unless they have surgery and hip removal and so forth. So what we would do is we would tell or give the suggestion to the subject to put his or her hand into a pail of frozen water, okay, and freeze this hand. It's called glove anesthesia. It's really, really common. Now I want you to take that hand and you put it on your hip, and for the rest of the day your hip is going to remain frozen. I would make a CD giving this suggestion to the person, and you would see some instant pain to a certain degree, certain percent of pain relief in that hip area throughout the day. And again, it does increase as you move forward with time. Let's see. We already talked about the migraines. So there's Carrie from Facebook. She contacts me, an old friend. She says, I have intermittent pain. So she fell and has intermittent pain in her joint area. As long as the doctor clears her to visit a hypnotherapist, it's fine, and you give that suggestion that let's say I'm walking, she's obviously got some bone-on-bone problems there, and she's pinching a nerve or what have you, but you would give the suggestion that when that pain comes up, it begins to decrease, and just, let you know that, hey, I need to take it easy on this leg, okay? And that's okay. So you're working both sides of the street. You're not really looking for the pain, but when it does pop up, this is how we're going to treat it. Okay, so that's kind of cool. Also, we got into the subject of fibromyalgia. I'm just going to quickly look over here and see what else is happening on this counter. Okay, fibromyalgia, which is a pain. It's a mental issue. All right, absolutely incredible way to use hypnosis, because it is related to some kind of mental psyche. Who knows? But it's pain throughout the body that comes and goes. So there's a gal on the street down here. I mentioned it to her. I said, hypnosis. Just sat through this hour-and-a-half long seminar with one of the reigning medical treatment guys in town, and he highly recommended hypnosis for fibromyalgia. And so I thought that was really, really cool that he would recommend hypnotherapy for something like that. So that is very, very severe and very hard to prove that you have it. A lot of people associate it with laziness, and it's just not true. It's pain throughout the body. So hypnosis, and that is a classic example. So I talked to the gal down the street, and I said, hey, what do you think about this? Let's try it. And she says, well, they've already tried to hypnotize me, and it didn't work. Well, when you have that kind of attitude, it isn't going to work, okay? Hypnosis requires a certain amount of faith. You got to believe that it's going to help you. And if you don't, well, guess what? It's not going to work. So that's kind of a drag for her. But what I suggest everybody do is do a little research about hypnotherapy and chronic pain relief, and then start training. Start listening to some meditations. There isn't a soul out there that cannot be hypnotized if you have the right operator and if you take the time to relax. I mean, that's basically all it is just, getting your body to relax, breathing good air in the nostrils and exhaling out. And, you can just do breathing 3 times. Just about any situation, you're going to see immediate results if you're meditating, say, once a day. I recommend everybody meditate at least once a day during their lunch hour. Take their lunch, split it up, eat through the day, and then go out and meditate in your car. Once again, my name's John Koscki. Don't forget to make a comment. It's really, really important. I know it takes a couple of extra seconds. You can subscribe to the show.